Hello, welcome to this introduction to schema therapy. My name is Dr. Jo White. I'm a clinical psychologist and I'm also a advanced certified schema therapist, trainer and supervisor. And here is a little introduction to schema therapy for you. Okay, so my aims of this little session are to give you a brief overview of the model, to help you to understand a snapshot of what schemas and modes are, and to think about some of the clinical applications of schema therapy. So what is schema therapy? So we've got a combination of the theoretical model and the structured intervention. So this is a model that was developed by Jeff Young and colleagues. It's an integrative model, so that means that it's pulling together various psychological models, including CBT, attachment theory, Gestalt, object relations, and psychoanalytical ideas. And they come together to develop this idea of schemas, which are deep patterns from unmet emotional needs. And I'm going to talk to you a bit more about schemas in a minute. And the schemas show up within modes, day-to-day life, and this is moment-to-moment emotional states. So that's how the schemas come alive in the individual. And then this is all framed within a structured intervention where we use experiential techniques, including imagery and chair work. And this is about working with the emotions, working with the challenges, bringing the difficulties alive rather than just talking about problems. Cognitive and behavioural techniques, which I'm sure will be familiar to many of you, and a particular relational stance called limited reparenting. In limited reparenting, we're working on meeting the unmet emotional needs via the relationship between the therapist and the client. So what are schemas? A little bit more about what schemas are now. So schemas are maladaptive, and they're a framework through which individuals organise and make sense of their experiences, relationships, and the world. So they're like a pair of glasses that the individual puts on that influences the way that they interpret everything. They're based on past experiences where the individual's emotional needs have not been met repeatedly, and the schema made sense considering their experiences. So particularly within the attachment relationship, if a emotional need is not met on a regular basis, like the drip, drip, drip of a tap, then that leads to the development of a schema. Schemas are a broad and pervasive theme or pattern, and they comprise of four things. So memories of those needs not being met, particular emotional patterns, particular cognitions or thoughts, and bodily sensations. So schemas are made up of all of these different elements. And here are the 18 schemas that Jeff Young identified. So just giving you a moment to have a look through those different schemas. Okay, so just let's have a think through a couple of examples of particular schemas. So the first one that I'm going to think about with you is the abandonment instability schema. So this is a perceived instability or unreliability of significant others to be present for and provide support, connection, strength, or protection. The individual may fear that others will die imminently or abandon the individual for somebody else. So in this example, Maria, who's 32, becomes extremely anxious whenever her partner doesn't reply to messages. She fears he's losing interest and will eventually leave her, like her father did when she was a child. So let's look at Maria's abandonment schema in a bit more detail. So the key cognition that often comes up for Maria when her abandonment schema is triggered is people I love will always leave me. A key memory for her, so one of the memories that links into this schema developing for her is remembering her father packing his bags and leaving the family home when she was 7. And so sometimes schemas develop from some very kind of big T traumas, for example, family breakdown, father leaving, or can develop from little T traumas, so repeated smaller events that happen over time. The feelings that show up for Maria when her abandonment schema is triggered are panic, sadness, helplessness, and longing. And the body sensations, a tight chest, racing heart, and trembling hands. So this is how Maria's abandonment schema shows up for her. And another of the 18 schemas is called the mistrust and abuse schema. So in this schema, when this schema shows up, the individual expects that others will intentionally hurt, abuse, humiliate, cheat, or take advantage of them. And harm is usually perceived to be intentional or the result of unjustified and extreme negligence. And so here the example is Jamal, who's 28, and he struggles to open up to new friends. He assumes they'll betray him like his older brother who used to mock and humiliate him in front of others. And so let's think a little bit more about how Jamal's mistrust schema shows up. A key cognition for him is if I trust people, they'll hurt or humiliate me. A key memory, so he recalls his brother laughing at him in front of his classmates when he cried after being teased. Some of the feelings that Jamal experiences when his mistrust schema is activated: anger, fear, shame, vigilance. And then body sensations, so a tight jaw, clenched fist, this tension in his stomach, and hyper alertness that comes with that vigilance. Okay, so just taking a moment now to think of a time recently when you felt tricky emotions. So we're going to help you to identify when a schema might have come up for you. So not a really difficult time, just a time recently when you noticed some difficult emotions. What story did your mind tell you about yourself in that moment? How did you feel? Does this connect to any memories of similar experiences? And how did your body respond? This is an example of a schema or schemas being activated in you. So just taking a big breath and letting that go now. Okay, and now let's have a think about how schemas and modes link together. So as you remember me talking about in the beginning, The theoretical model thinks about schemas and also thinks about modes. So modes are the moment-to-moment emotional states or parts of the individual. And so an example of this is where a client might come into the room with me and they might appear quite flat and emotionless. And then they might shift to feeling incredibly sad. And then I hear self-criticism coming in. And then the individual might shift to being very emotionally cut off again. And so in schema therapy, we'd call this mode flipping, where somebody moves from particular emotional states through to another. And modes are how an individual behaves, relates to themselves, or copes when their schemas are activated. So we have the schema activation and then sort of the behavioural presentation of that, how it comes alive. That's the mode. And so there are different types of schema modes. So we have a structure within the mode system. One of the types of modes is the vulnerable child mode. And this is the part that feels all of the vulnerable emotions when the schemas are activated. And arguably, it's the most important mode because we are trying to connect with that mode all of the time. This is the mode that feels the emotions when needs aren't met, when emotional needs aren't met. That brings about an emotional response. And in schema therapy, we try to meet those emotional needs and teach our clients to meet their own emotional needs. So we're helping them to look after their vulnerable child and find ways of getting their needs met. And so I'm going to use the example of Maria from earlier with her abandonment schema and think about how it looks for Maria when her vulnerable child mode is activated. So when Maria is in her vulnerable child mode, she feels scared, sad, and desperate for reassurance. She thinks, please don't leave me. Physically, she's got a tight chest, she's trembling, she's tearful, and she's showing her deep fear of being alone. A second type of mode, so the critic modes. This is the sort of inner chatter, the repeating messages that are internalized from childhood that can be critical, punishing, demanding, pressurizing, guilt-inducing. And so we aim to externalize those critical messages, to turn the volume down on those messages so that the critic mode is not having such an impact on the person's feelings and needs. And so when Maria's critic mode is activated, she blames herself for being too needy, not good enough. So these are sorts of messages the critic mode is giving her. Her inner voice has got a harsh and shaming tone. No wonder people leave you. You're pathetic. She feels guilt, self-disgust, and tension in her body. And so you can hear how when Maria's vulnerable child is activated, that abandonment schema is activated, that the critic mode comes in and just makes the situation so much worse, with all of the pressure and the criticism and the punitiveness that it brings. Okay, and a third type of modes are the coping modes. So the coping modes are survival responses to help manage the schema activation. They involve avoidance, surrender, and overcompensation. The coping modes perpetuate the schemas, so they tend to block the vulnerable child from getting their needs met. Maria copes with her fear of abandonment by either clinging to others, shutting down, or acting overly independent. These modes help her to avoid the pain of abandonment, but they also keep her feeling alone and unseen. And so we'd be working in schema therapy to help her to recognise those coping modes coming up and stepping aside from them so that she can start to get her emotional needs met. And then we've got the fourth type of modes, which are the healthy modes, including the healthy adult mode. The healthy adult mode connects and meets the needs of the vulnerable child mode through nurture and protection. It's able to balance the needs of the individual with the needs of other people, and it demonstrates an ability to be kind of flexible in coping and self-awareness. So it might be that some of the ways of coping are helpful in certain circumstances, but often when coping modes come in, they come in a very rigid way. And the healthy adult mode supports the individual to be flexible in its coping. So when Maria is in her healthy adult mode, she can soothe her fears and respond with balance and self-compassion. She reminds herself that her partner not replying doesn't mean she'll be abandoned. So you can hear that's a more balanced, supportive, nurturing way of looking after herself when her abandonment schema is being triggered. Okay, another chance to reflect on our own experiences. So just take a moment to imagine the same triggering moment again. What part of you shows up? Was it a vulnerable side that felt and connected with strong emotions? Or was it a critical side or a pressurizing side? Or was it a coping mode there to try and help you move away from the feelings or the critic mode? Or maybe you noticed several different modes. And so these are our modes showing up, our responses to schemas being activated. Okay, taking a breath again to let go of that experience. Okay, so just thinking about the aims of schema therapy. So one of the first aims is to connect to core emotional needs. To many clients, emotional needs come as a surprise. They don't recognize that they have them, they don't know what they are, and they struggle to connect to what their needs are. And so we need to support our clients to understand what emotional needs are, and understand that when our emotional needs are met within relationships and in our lives, then that allows us to move forwards and grow. We can feel connected within relationships and we can process difficult events. So there's lots around awareness and connection to emotional needs. The second area that we're aiming to address in schema therapy is to support that schema healing. So this is about processing the events that led to the schemas developing in the first place. So, for example, somebody who may have experienced traumatic events in childhood, they develop this sense that it was all my fault, I was bad, I deserved to be hurt in this way. Maybe a defectiveness schema developed. And so they bring that belief that they're bad, and that's why bad things happen, because they're a bad person. They bring that belief into the present. And when anything happens in the present within their relationships or their experiences, they blame themselves for it because of that defectiveness schema. which makes the situations in the present worse. They don't know how to protect themselves. They don't believe that they deserve protection. And so further traumatic events happen in the present, and then there's further self-blame. And so by healing the schemas, healing that defectiveness schema in the past and revisiting early experiences, learning to recognize that they weren't their fault, that they were a child, that they didn't deserve to be treated in the way that they were treated, that helps to heal the schemas. We also want to reverse maladaptive coping responses. So these are the coping modes. We really want to help people to understand that their coping modes are survival strategies, and they needed them when they were little. So we're wanting to validate those coping strategies, but also recognise that in the present, they're no longer helping the individual. And so, for example, an individual that was never cared for as a child might, as an adult, shut down and emotionally disconnect and never show their distress to anybody, because then they don't have to feel the pain of someone not caring about them when they're in a distressed state. But also, as a consequence, they never receive the care that they need and they deserve. And so that coping mode of shutting down and not showing anybody their emotions, we would be looking to help somebody to use that coping mode much more flexibly, to know when it's safe to show emotions, to know who are the people that they can get their needs met from, and first off, practice that in therapy, being able to show their authentic emotions. Okay, and the fourth aim here is to build the healthy adult mode. So this is one of the healthy modes. It's the mode that's tuning into needs and finding ways of meeting those needs. And so we're growing that healthy adult mode so that they can start to recognize when their schemas are triggered, recognize what they might need in those moments, get their needs met, feel connected within relationships. And so who is schema therapy for? Well, it's a transdiagnostic model. So it focuses on the underlying patterns of thoughts and emotions rather than specific symptoms, which means that we aren't drawn into particular diagnostic categories. We can look across diagnosis and look at the ways in which people are thinking and feeling and behaving. It's aimed at working with people with chronic and complex difficulties. So Jeff Young developed schema therapy because he was finding that CBT wasn't able to work at a depth that allowed people with these very complex difficulties to move forwards. I always talk about schema therapy as being aimed at people with attachment-based trauma. So schemas develop from insecurity and unmet needs within the attachment relationship. And so often the people that might come to schema therapy and benefit from schema therapy have had those very tricky relationships in their early life where they weren't safe within their families. They didn't get their needs met in those scenarios. It's also aimed at people with long-standing patterns of challenges relating to the self, so the way in which the individual views themselves and in relationships with others. This is also known as personality disorders. Now, personally, I don't like the term personality disorder, and it's not a category that I use or align to. However, if you read the schema therapy literature, you will come across this term because the model was developed to address these long-standing patterns relating to the self and others. Okay. So that's my overview of schema therapy. I hope that has been useful. If you would like to find out more about schema therapy and to join our training, then you'll find more information on my website, www.schematherapyworks.co.uk. I've also got many different blogs that I've written on the website of lots of different topics from schema therapy that are very accessible and easy to read. So please do have a look at those and get a better flavour of schema therapy from those, and reach out if there's any questions that you've got or you're interested in joining me and Kate for some of our core schema therapy trainings or any of our specialist workshops. Thanks, Anne.